When you think of oral health, what comes to mind? White straight teeth? Brushing after meals? Regular flossing? All of those things are necessary for good oral health. But it goes much beyond just the basics. The mouth is not separated from the body. What's more is that it is a major gate into it. What happens at the gates can influence what goes on deep inside.
Poor oral health, besides having aesthetic and social implications, can lead to unwanted weight loss, dangerous bacteremias, endocarditis, and prosthetic joint infections. It may even lead to oral cancer.
Periodontitis is an inflammatory disease induced by bacteria that destroys the connective tissue and bone that supports teeth. According to Dr. Paul Blaha, periodontitis has been extensively researched of late for possible associations with other diseases.
Cardiovascular disease, arthrothrombosis, diabetes, metabolic syndrome, osteoporosis, obesity, Alzheimer's disease, rheumatoid arthritis, adverse pregnancy outcomes, and even cancer. These diseases, including periodontal disease, appear to have something in common, and that is inflammation.
Modern medicine recognizes the major role inflammation plays in many diseases.
In inflammatory diseases, the body's response to inflammation is chronically maladapted, so there is no resolution to the inflammation, and the tissue does not return to homeostasis. Many chronic diseases develop over decades, and inflammation is known to play a contributory or critical role in most chronic diseases of aging.
A study published in the April 2008 issue of the Journal of Dental Research discovered evidence that pregnant women with periodontal disease are more likely to develop gestational diabetes mellitus than pregnant women with healthy gums. The condition usually disappears when the pregnancy ends, but women who have had gestational diabetes are at a greater risk of developing type 2 diabetes later in life. This study underscores how important it is for expectant mothers to maintain good oral health.
Periodontal diseases are complex, chronic, inflammatory diseases initiated by tooth-associated microbial gram-negative biofilms. The bacteria, endotoxins, enzymes, and metabolic byproducts penetrate the epithelium and cause a host immunoinflammatory response, bacteremia and endotoxemia. An increased concentration of inflammatory cytokines, chemical mediators, and acute phase proteins lead to the destruction of connective tissue and alteration in bone metabolism, resulting in the net loss of bone. If untreated, the end stage of periodontitis is tooth loss.
Many of the causes of periodontitis are related to lifestyle choices. In fact, in a recent prospective study of young adults aged 26 to 32 years, as many as 2/3 of new cases of periodontitis were attributed to smoking. In addition to poor oral hygiene, the disease can also be caused by other health problems.
I had a lot of gum disease in the early parts of when I was first diagnosed. A lot of plaque buildup. I'm a diabetic. Diabetics build a lot of plaque considerably faster than most people. So a lot of plaque buildup, and as a result of that, a lot of periodontal disease, deep pockets between the teeth and the gum tissue.
David was diagnosed with late onset type 2 diabetes at the age of 34. It eventually progressed into metabolic syndrome. His medications have changed accordingly. We have treated him not only with supportive periodontal therapy, but also with scaling and root planing, which is a non-surgical therapy, and surgical therapy locally as needed. Overall, his control of diabetes is actually right now quite a bit better than it used to be in the past.
Dr. Blaha, a periodontist in Sycamore, Illinois, has been treating periodontitis for many years and has seen mild to severe cases.
Genetic variations account for about 30 to 60% of the variability in the clinical severity. Epigenetic factors such as diabetes, smoking, osteoporosis, immunodeficiencies, lupus erythematosus, bacterial load, nutrition, obesity, and stress modify the disease and produce changes in tissue behavior.
The work that Dr. Blaha has done has kept my mouth healthy, it's kept it clean. I get my teeth cleaned 4 times a year, as opposed to once or twice like most people. So by keeping the teeth clean and having that work done in the past has created very good mouth health over the past several years for myself.
Most patients with untreated periodontitis present with gingival inflammation, such as redness and edema, and loss of supporting tissues. The clinical presentation does not reflect the biological phenotype, which sets the individual's inflammatory capacity and is then modified by epigenetic factors.
Despite the seriousness of the disease, Dr. Blaha says that there are viable treatment options available.
The treatment typically consists of proper oral hygiene instructions, scaling and root planing, followed by periodontal surgery, wear and, if necessary, and periodontal supportive therapy. Oral antibiotics and controlled release locally delivered antimicrobials have also been used. Future treatments will modify the host inflammatory response, block periodontal destruction, promote the restoration of homeostasis, and will be individualized for the patient based on that patient's genomic and molecular information linked to clinical data, allowing us to treat the patient, but perhaps even prevent the illness.
Dr. Blaha also performs cosmetic periodontal plastic surgery. Marty LaCourciere was referred to Dr. Blaha after having problems with dentures that prevented her from eating solid foods. Dr. Blaha performed implant placements, which allowed her to receive a new implant-supported denture.
Oh, it's wonderful. I would recommend it to anybody. Can eat almost anything. Have no problem. Yeah, it makes a world of difference.
The emerging picture seems clear. One of the pathways to good health may very well be through the mouth. For more information about periodontal disease and the mouth-body connection, contact the office of Dr. Paul Blaha.